Welcome to another lecture, and today's topic is the Calot's triangle, and this is the anatomy lecture. First of all, let's see the Calot's triangle. It is laparoscopic view of the Calot's triangle, and here we can see this is the liver. This is the liver, and this one is the gallbladder. This is the gallbladder. Here, this is the uh, different duct of the gallbladder here, and this triangle is the Calot's triangle. Here we can see this is the Calot's triangle. So here we can see in pictures, this is the Calot's triangle. The Calot's triangle or cystohepatic triangle is a small anatomical space in the abdomen, and especially it located in the undersurface of the liver. Here we can see this is the liver, here gallbladder, and from the gallbladder cystic duct forms the common bile duct after joining with the common hepatic duct, and common hepatic duct it is formed by the right and left hepatic duct. And this area, we can see this area from here, this a triangular area which is known as the Calot's triangle, and this Calot's triangle plays important role because during cholecystectomy procedure this triangle should be identified carefully to avoid the injury of the common hepatic duct or common bile duct. Here we can see this is the common bile duct, and here this is the common hepatic duct. So for avoidance injury to the common hepatic duct or common bile duct, the surgeon first have to identify the Calot's triangle. And another importance of here, we can see the different structure present here, and identify this structure, and ligation of the structure is required. This is the hepatobiliary triangle or Calot triangle. First of all, medially, this picture here, we can see some structure lies this side, which is medially, and this is inferiorly or laterally, then here, this is the superiorly. So these three boundary we have to remember very carefully. So first of all, medially or left side, it is by the common hepatic duct. Common hepatic duct. Inferiorly, it is by the cystic duct, and superiorly by the inferior edge of the liver, and its contents is the most important content is the cystic artery. There are some other important structure also, but the cystic artery is the most important content of the hepatobiliary triangle or Calot's triangle. So let's see again, this dot area is the boundary of the hepatobiliary triangle or Calot's triangle, and here we can see this is aorta, that means it is the left side, and left side it is bounded by this structure which is the common hepatic duct. Here we can see this is the common hepatic duct, and inferiorly this is the inferior part, it is bounded by the cystic duct. This is the cystic duct, and superiorly here this part is the superior part, and it is the undersurface of the liver. So this is the boundary of the hepatobiliary triangle or Calot's triangle. So this boundary have to remember very carefully for all aspects. And here we can see this content, most important content is the cystic artery, and this cystic artery is supplies the gallbladder, and this cystic artery should be ligated, otherwise there will be severe hemorrhage, because this cystic artery here we can see it is very close to the abdominal aorta, which is a large vessel. In the second picture also, here we can see this is the different structure. First of all, here this is the cystic artery, cystic duct, and some other structure here. So this is the content. Here we can see most important content is cystic artery. Another one is the cystic lymph node of the lung, and other structures such as the right hepatic artery, connective tissue, lymphatics, and sometimes the accessory hepatic ducts and arteries. So content, first content is the cystic artery. This is the another picture, and this picture also, here we can see this is the hepatorenal triangle. Here we can see this is the superior boundary. Superiorly it is bounded by undersurface of the liver. Here this is the inferior boundary, which is the cystic duct. This is the left side or left boundary, which is this one is the common hepatic duct. And cystic artery, here we can see this is the cystic artery, and the cystic artery, it is branched from the right hepatic artery. This information is also important, that the cystic artery, it is branching from the right hepatic artery, and the cystic artery is very close to abdominal aorta, because from the abdominal aorta, here we can see this is the common hepatic artery, then proper hepatic artery, then right hepatic artery, and from the right hepatic artery, cystic artery. So profuse hemorrhage occur when there is injury to the cystic artery. And now the clinical importance of the Calot's triangle, it is also important because during the cholecystectomy procedure, either open cholecystectomy or lap cholecystectomy or laparoscopic cholecystectomy, in both cases the surgeon should be more careful to avoid injury to the different structure around the gallbladder. So here we can see, first of all, cystic artery and cystic duct, it must be identified and ligated. So for any surgeon, the surgeon have to be very careful to identify, first of all, cystic artery and then cystic duct, and ligation of the cystic artery and ligation of the cystic duct, and then cholecystectomy was done, and division to avoid intraoperative injury during the cholecystectomy operation, especially the important structures such as the common bile duct and common hepatic duct. So let's see the picture of common bile duct and common hepatic duct. Here it is very, as it is very important. Here we can see, this one is the common hepatic duct. So there is a chance of injury to the common hepatic duct. Also there is injury to here, which is the common bile duct. So these two important structure may be injured. The duodenum also may be injured, but it is very rare relative to this structure, which is the common hepatic duct and common bile duct. And during laparoscopic procedure, sometimes there may be injured this common hepatic duct or common bile duct, and this if this happened, the surgeon then converted the lap cholecystectomy into the open cholecystectomy, and then the repair of the common bile duct or common hepatic duct was done, and then cholecystectomy done. So this is, I think this is now clear that during any procedure, that means the open procedure or closed technique, there may be chance of the injury to this common hepatic duct or common bile duct. At that time, this injury should be repaired. Otherwise, the patient will develop jaundice after some time. Actually, the conjugated hyperbilirubinemia, and that will be the disaster complication of the cholecystectomy procedure. So this is all about the anatomy of the Calot triangle. Thank you all.